The goal for Identity Enforcer truly is to get humans out of the way. I want to take our provisioning team and let them do other things. Take all the mundane tasks that they do, create a login here, delete a login there, and let Identity Enforcer do all of that. Then take the entire IT department out of the way and just let the end user and their management determine what the appropriate levels of access are and have the system do it for them. Avatier is very easy to work with. The support team, I can't say enough good things about. They're there for us for whatever we need. You get back into development. Development has a commitment to doing the right thing for us. They very much take over that integration point. They work with our vendors so that their solution fits in. It's not left to me to try to pull those two things together. Then you get into management. Management's very flexible. They work with us so that we can do the things that we need to do within the budget that we have available.
The support I get from Avatier is leaps and bounds above what other software companies provide.
We started in 2004 with Password Station.
Password Station connects to a huge module that we use that is very important in the hospital. It's called McKesson Care Manager, and it has a lot of different modules in it, and we also have a SunQuest connector. And these were not out of the box for Avatier, but they did assist us in customizing them to fit our environment.
We've rolled Password Station to every desktop in the organization, which is almost 4,000. We also have it published so that any of our physicians from their office can reset their password.
Well, one of the biggest pieces, I think, for Password Station is that it syncs passwords. So instead of the users having multiple passwords and having to remember them all, when they reset through Password Station, all of their passwords are the same. So their network login, their McKesson Care Manager login, their SunQuest lab system login is all the same. And it's much easier on the end user when they reset through Password Station.
We have 800 physicians and their associated staff that have access to information within the hospital system. All of them manage their own passwords through Password Station.
It's frustrating sometimes when you're trying to get things done, but you know, you're providing patient care, so everything's always top priority. You know, everything's always stat. You need it ASAP, so it can be really hard sometimes to prioritize things because everything is very, very important, and it could impact somebody's life. So it can be challenging.
We had to look for something that was industry standard, something that could be supported easily, and something that we could roll out with the staff that we had. Since then, we've grown. We've added a whole lot more. We've also added more demands on Avatier. So on top of resetting passwords, we're now also creating new users, transferring people, and terminating people.
Identity Enforcer is incorporated with our Lawson system, and it is incredibly, incredibly easy to use. It's connected with the Lawson HR data that comes through, and it Avatier automatically generates the user accounts and adds, you know, the different access levels, and it's just amazing. It has saved us so much time.
Avatier's icon-driven system makes it easy. How easy? Our staff of 3 handled 11,000 transfer requests in the last 3 months without breaking a sweat.
It's also very helpful for terminations because it can disable the account automatically. So if you have, you know, someone that leaves on not the best terms, then it can disable that account right then and there.
Our turnover, like we talked about before, is over 11,000 in a 3-month period. When you start having that many requests, you can't add enough people to keep up. We needed automation. So we went looking at our partners first, and Avatier had a tool that met our needs and exceeded our expectations.
We are bringing on a lot of new physician offices and employees. We're growing rapidly, and Identity Enforcer is helping us to keep up with our growth rate. When I first came into this role and started working with Avatier, I didn't know much at all about IT or information security at all. And the Avatier support team has been a huge help to me. They've been very, very patient, and they've spent a lot of time with me and helped me learn this application and to craft it to what we need for our organization.
We manage thousands of roles. We do that with 3 people.
We handle around 11,000 requests every quarter, and with a staff of only 3, Identity Enforcer is a huge help in making sure that we answer all the requests that come through and that we get the access that's needed for all the employees and physicians in the organization.
There's no need in going to the market to look for other solutions when you have a partner that's worked with you and worked successfully with you that offers the exact same thing.
I'm really comfortable with Avatier and the software, and is really doing a lot for our organization. We're in a good place with it, and I think it's just going to grow. I think we're going to continue to add new systems, new applications, and to use it in a lot of different ways. It's been a really good product.
Medicare and Medicaid are our 2 major payers. Those reimbursements are going to continue to go down. Couple that with increased demand. Baby boomers are aging at a rate of about 3 to 4 million a year, added to the Medicare and Medicaid rolls. We have to be smart with the money we spend. We have to do everything that we can to push our costs down.